Well, a health workers union is blaming the political class for the alarming surge of COVID-19 infections in the country. The Kenya Union of Clinical Officers says the country has seemingly entered the second wave of infections, which could spell doom for the country. They are now calling on the government to equip health workers with adequate and appropriate protective equipment. Ruth Sarmoi has more from Nakuru County.
As COVID-19 infection numbers keep on an alarming upward trajectory, concerns are being raised on whether the country's healthcare system can withstand another round of pressure. Frontline medical workers say the trend is troubling, with at least 2,000 medical personnel in various cadres affected since March.
It is no longer in doubt that we are in the second wave, and the curve is rising steadily than the first wave. We, the frontline healthcare workers, are having to bear the burden as admission soar, more medical contract the virus, with some paying the ultimate price. As we speak, we have lost 2 clinical officers for the last 1 month, and over 310 clinical officers have been infected.
In Nakuru County, at least 20 clinical officers have tested positive for COVID-19, whereas another 15 healthcare workers have tested positive for COVID-19 at the Kakamega County Referral Hospital. The clinical officers are now sounding the alarm over a looming shortage of ICU beds in medical facilities as well in the isolation centers. They now want the government to release the 6 billion shilling worth of PPEs lying idle in KEMSA stores.
We have revisited several facilities, and only all of them who we have found seeing patients are using surgical masks, which the quality has been doubted. And we must say that that is against the policy of the government, where we spend a lot of money coming up with those policies.
Then there is the issue of welfare of the frontliners.
All health workers with pre-existing disease and condition, those who are pregnant and those who are above 55 years of age, be excused from active duty until this transmission is actually addressed and managed.
The union further recommends suspension of all political and unnecessary gatherings across the country until the fast spreading virus is contained.
Wanasiasa waache tabia mbaya. Kwa sababu ni tabia mbaya. Wewe unafanya siasa zako, unaleta watu pamoja, unafanya waambukizwe, wakikufa jamani, hiyo BBI yako itakusaidia na nini?
Ruth Sarmoi, NTV.